Hi, everybody. Can you guys all hear me?
Yes.
Yes.
Hello.
Awesome.
Hello.
So I'm China. I'm speaking. I'm not sure if it's showing me. So Lynn and Abby are preparing to host this meeting. I am here to manage the chat. So if you guys have any questions, please feel free to post your questions in the chat. As we are going through this. As you can see, Lynn is lubricating her body. Abby is all set. But what we're going to be doing today is talking. Well, first, we're going to start by talking about the difference between the Graduate Resource Center and having a membership, because those are two different things. The GRC is accessible if you are a DeepFeet One grad. It's got all of your post-class information, videos, and Lynn is going to elaborate a little bit more on what that is. And then the difference between the membership. So some of you have paid for access to this video today, but you are members, so you don't have to pay. And then we're going to get right into hip one, hip two, and hip three, which is the center line, the medial line, and the lateral line. So Abby and Lynn are going to talk about a little anatomy, a little differences of the strokes, and how we teach them in Deep Feet One.
So I feel like once we start getting to hips, everyone on day two is like, oh my gosh, this is getting really complicated. So I just want to review with everybody first that how we work is with our down foot. And the first thing we do is just compressions and AMA rolling. Then we are going to tarsal twist. And we are working really glute max, med. And when I get to those outward rotators, I'm going to sink into that glute fold, pausing, and then I'm going to travel down the leg. So it's a good angle for everyone.
I think so. Yeah.
Okay, we can lobster claw. We're going to effleurage. I like to effleurage ankle to knee. And then I like to effleurage from the glute fold to the knee. And so see how I'm standing over my work, in my bars. Everything's at a nice 90-degree angle. And then I can come right back up and go right into some tarsal twisting. So things that I notice that people get a little uncomfortable with, because now that we are working the hip, it's all rounded. And so everyone starts to feel like I went from this flatter surface here of the back to this round hip. And now I don't really know what to do with my foot properly. So, what I want to talk about real quick is standing at that angle definitely allows for us to compress and really hit the glutes nice and deep. What else you need to get comfortable with is pushing into my client. So see how I'm pushing into Brian to get that compression. And so this allows for me to utilize weight and gravity and pushing into him to get the most effective massage stretch or massage movement that I'm doing. When we're working, a lot of times we're just learning and people are standing like this and they're maybe moving their body a little bit, but they're just touching the skin. Can you guys see that this is like nothing happening? Versus I'm leaning out of my bars a little bit and I'm pushing into Brian to get that compression. And then when I'm tarsal twisting, I'm pushing down into his glutes to get that compression. Can you guys see that, China?
Yeah, nobody has made any comments, but
Okay.
I would say that we definitely can. I'm getting some thumbs up coming in and some yeses.
Okay, perfect.
I solicited in the comment section. But
Okay,
yeah,
perfect.
it's good. You're clear in between the iliac crest and sacrum and the greater trochanter. That's a perfect place for your foot. Victoria, would
Yeah.
you like to repeat once more?
Okay, I'm going to do another one.
Okay.
The other thing that you do need to start getting used to and working with is um, just palpating around the femur and the glute and just seeing like where are the bony prominences. So,
Mhm.
like, this is the head of Brian's femur. Right now, I'm directly above it with my heel. Here is his sacrum. And then right here, I'm going to be right at the SI joint. So, one thing I'll show you next, once Abby's done, I like to start with hip two and I start my services with the legs versus seated. And that's a whole nother conversation for another day. But
Sorry, Lynn. So Dolores has brought up a good point. If you're shorter, your non-working foot would be closer to the hip, which is true because I'm a little bit shorter. Lynn, are you 5'8"?
I'm 5'8", yes.
Yeah. So Lynn is pretty
So I'm
tall.
standing here
Yeah. Yeah.
working,
I
whereas you guys might need to stand
yeah.
down here.
And how tall is Brian there?
Brian, how tall are you? 6'2".
Okay, yeah. So I definitely would be standing closer to his hip with my standing foot. So good question, Dolores.
Yeah,
All right, sorry, continue on.
that's okay.
Your turn.
So I was just saying, like, one little variation I like to do for hip one, and you can do this on your way back, but I do like to come into the erectors of the back, dragging that tissue back over the sacrum.
Hmm.
And then I can really feel with my toes, like right here, I am on his sacrum. I'm right at the SI joint. And I just turn and I start my twist, my tarsal twist. My hands are on the bar away from me. So not above my head, but the one away from me. And then I can compress and sink into that glute fold. And I'm now standing in between my bars. And then I just lean a little bit to start to travel and get that effleurage stretch or massage. I don't know why I keep saying stretch today, but apparently stretching is on my mind. So that's my little variation of how I like to come down. Does that give Victoria the extra stroke she wanted to see?
Victoria, where did she go? We got to look. Oh, there she is. Victoria, are you good with that? Yes, she said yes.
Okay,
Awesome.
perfect. So I'm going to jump down. I'm going to let Abby, I'm going to spotlight her and let her talk about any variation from hip one. And then she'll do hip two and her variations from that. Okay.
We're safe.
Abby,
Yeah.
you are spotlit. You are good to go.
Okay. Hi, everyone. Welcome. I'm glad you're here. Please use the chat box if you have questions or even if you just want to say hi and let us know who your instructor was. We're happy we have so many people here today. So the first thing I just want to start with in gaining confidence on working with the hip, it's really important that you know your anatomy well. So I just recommend look at your anatomy books often or on your apps on your phone so that you're really familiar with what muscle groups you're working with, right? And then also knowing your bony landmarks, which is what Lynn just pointed out. Also, she was talking about being right there at the, iliac crest, the sacrum, the ischial tuberosity. Those are our bony landmarks and the greater trochanter. So really understanding where your foot is and what you're working on will be helpful. And then always remembering, going back to our good, clear communication, right? If we're working with our clients, we're learning how to work efficiently and effectively on the hip.
Oh no, Abby.
So study your anatomy, get to know it really well, feel it with your foot, like Lynn was, explaining as well. And then my variation that I like to teach is that what I noticed is that some people don't like to have their arm off the table so much during the massage. So I have, also, this table is rounded in the front, so sometimes people's arms fall forward. So I've learned to work this hip 1 and hip 2 with the arms still on the table. So we're just going to come to it at a different direction, just slightly, but the goal is still the same. We're still using the same non-working foot. My non-working foot will be very close to her hand, and I'm just going to find that sacrum border and do my tarsal twist from there. Now, it's true that the AMA roll is not as accessible in this position, but I'll do the AMA roll on hip 3. So I'm going to start with just some nice compressions. And can everyone see okay? It's really just the same.
Yeah. You're getting thumbs up and yeses.
Okay. So my body position, in my last class, I mentioned to everybody, work like somebody is watching you. That means having your posture nice and tall. Okay, and I'm nose over knee. I'm getting my compression. And Eileen, would you like more or less pressure than this?
Can go more.
Can go more. So she wants more pressure. So I'm just going to lean my body forward. I also might place my hand above my knee. Did that increase the pressure?
Mm-hmm.
Thank you. And then we come down over the sits bone, the ischial tuberosity, a nice deep compression, and down the leg. And also, don't forget this one. It's also in your manual. Please read your manuals. That's really well written. And it also explains additional strokes like this. And that's really nice. It completes the body well. Lynn, do you mind if I just go ahead and go into DeepFeet 2? Hip 2?
You are good to go, Abby.
So I like to do this full body stroke, and people really comment on this one. I'm going to go nice full stroke. And then I'm going to step here. So I'm stepping between her body and her hand. And her arm. This is hip number 2. And like Lynn said, we can actually start on the erectors, going just gliding over the sacrum border. So I know exactly where my foot is landing for my heel to get right at that SI joint, sacroiliac joint, and heel twist. And I'm standing nice and tall, one hand is down. And as we heel twist down that sacrum border, and I'm going to find the ischial tuberosity, and again, do a nice compression and down. Would you like more pressure than that on that one, or was that good?
You can go more.
My client likes more pressure. So what if I need more pressure? I'm just going to stop and really just concentrate on where my heel is and what it's doing. Also really having, paying attention to your palpation skills, your listening skills with your feet, just like we would do with our hands. Super important here. So knowing your anatomy is one thing, but also knowing where your client needs the work is also the most important. All right, she likes that one. Woohoo! Okay, any questions or anyone like me to review that differently or go over it again? How does everyone feel about that? So that was just working with the hand up. You can also, again, yeah, working with the arm down is fine also, but I just think it's really important to be able to work with the arm up and know that you're still getting the same, the objective is still the same, arm up or the arm down.
And Dolores is also following up with working if you're shorter. Abby, how tall are you?
Like 5 foot.
Oh, so Abby is a peanut. So she was standing where she was standing and working perfectly. Ross is saying, so twisting right lateral to sacrum, right? Is that what you were doing? You were tarsal twisting lateral to the sacrum?
Yeah, the foot fits really, like the ball of the foot fits so perfectly. I'll go back up. So, you know, the foot fits, this is the sacrum, how the shape of it here. So I'm just going to come down. I'm aiming for piriformis, or sometimes I like to call it the top of the hill. It is the highest point on the gluteal muscles, and I'm right up next to the sacrum. I know a lot of people, when they begin, they're afraid to go too medial, but I encourage you to get comfortable with that. We could also aim for glute medius if that was more what my client needed. So glute medius is just a little more to the side. And we can also just take our heel down and get into that TFL, glute minimus.
Kristen is loving the long stroke. Thank you, Kristen.
Okay, I'll show you guys my latest trick then. So going from hip 1 to hip 2, I do this one.
Nice.
And then I just turn like that. And then I'm ready to go. Hip 2.
Very nice.
Okay, thank you, Abby. That was awesome. I am gonna jump back up, so I'm gonna spotlight myself. Okay.
Carrie asked if we could see that transition one more time. Will we have an opportunity to go back to Abby to see that hip
Yeah,
one?
Abby will come back on
Okay.
for hip 3 and she can
Carrie, we
show that
will-
transition. I can also show it right now.
Okay. All right. Perfect. And Stephanie said smooth.
So Abby was here. She was bringing in her heel in to the iliac crest, coming off of that. So I'm just going to push my heel into the client. I'm moving my toes down away towards the edge of the table to let my foot drop. And then you turn around and then you're ready for your hip 2. So what I wanted to start with is, and kick Brian's arm off, is how this move is taught in our classroom. We typically teach it 2 different ways, but the way that we have always been doing this ever since Ruthie founded the company is hip 1 is our down foot, and this is our warm up. Hip 2 is our up foot, and this is getting into some deeper pressure because we're going to use our heel. And so we're going to compress again if you want to. I have to lean out of my bars to get my heel. Can you guys see my heel?
Yep.
Into the glutes. And you can see, like, I can start way down here and I can push into my client to get my heel coming up, my whole foot working. And then I really get into my heel, into glute med. And then we actually turn around and we fall down off of the glute fold. and we come down the leg and we feather back with no pressure. So it's just a feather back. So I'm going to do that again. The one thing that most everybody struggles with in learning this move is this turnaround because they're turning too low. So I like to start that turn like right at piriformis, cutting over the glute, the outward glute rotators, and then sinking into that glute fold and then coming down the body.
Annie or Anne or Annie is asking any thoughts on what to do for that transition? And can you elaborate on which transition? Was it the one Abby did? If you have small feet, but a thicker client, she said yes. So Abby's transition. So we'll discuss that when we go back to Abby, okay?
Yeah, what I
She's
would say for that
concerned.
transition, if you have smaller feet, is that you're letting your toes hit the table and I'm pushing my heel into the client, pushing them away from my foot.
Your
I
heel is
can
almost
then,
going under them, right?
yeah, and then you can just see I moved my foot.
Mm-hmm.
So I let my toes touch the table. I push in. I can lift and dorsiflex and then push my toes back down again.
Does that make
Does that
sense?
make sense?
She gave a thumbs up.
Okay. So two things here I want to show.
Okay.
So when we're feathering back, if you want to make this feather back a little bit more productive, you can start to drag your heel in between the hamstrings. And this is all hamstring work for me. So I'm
Lynn,
really dragging.
would
Yeah.
you be able to lower your camera a little bit? We're
Yeah.
we're wanting a little bit more of the body instead of
Yeah.
we can see your feet more.
Let me see if that works.
Oh yeah, the closer. I think that's a better angle too.
Okay.
Or a better
Perfect.
distance. Thank you. Okay.
Yep. So when we're feathering back, I really like, especially for this one on my table, Brian, because he's a trainer, he cycles, does a lot of work, active work. So I really want to get into the hamstrings. And this is all hamstring work for me. And I just pull my heel right to the ischial tuberosity. Then I'm going to plantar flex, push my toes into the hamstrings, which lifts my heel up on the glutes. And then I can turn right back around.
Nice.
That makes sense. I was using the wrong foot, if everyone noticed that. But here it is again, using the correct foot. I find the ischial tuberosity. Then I go into the ball of my foot, allowing my foot to completely contour the hip. And then I turn, standing up nice and tall in my bars, turn back around, bring my heel to the table. And then I can go right back into hip 2 again if I wanted to. So this is the one reason why I really love the turning around that we do and coming down, is because I do really love to do this drag back and really separate out the hamstrings. It's a lot of fun. It is all hamstring work, but then this is all just, standing up into the bars and turning our body. So I mentioned before that I like to start my services with my client face up, at their feet. Goodness. And so I want to show the difference here. I just need to get a little bit more lotion on Brian. So once I get done, I usually do a venous flow. I'll do a couple of these to get started. I come up and I do our variation that we teach people. This is in the videos, if you guys purchase the videos. I believe it's a modification video as well. But I am hugging Brian's hips. So my foot right here, this is at the edge of the table. This is right next to Brian's hip. And I can move him this way. This is me coming in with my other leg. So I have him right in between my legs. Both legs are touching his body. I'm going to use my heel to drag up, pulling his body into this standing leg. And then I will start to tarsal twist. And then I will sink and I will come down the medial side of the leg. So for the muscles in this movement, we're really focused on glute max and medius. So I really like to come above TFL. So I come and start right above the trochanter, get right into TFL, dragging through glute max, getting into glute medius, or getting, sorry, you guys, I'm getting my anatomy all messed up. Glute medius, then getting into glute max, and then getting into the piriformis and glute minimus, sinking into those outward rotators to come down the leg.
Yeah, Carrie said I like that a lot. And that is my favorite as well.
Yeah. I do really love, though, the turning because
hurt.
you can really push into people's glutes. And then I love that drag back. So they're both super effective.
Ross is looking for some clarification. He said, so the pressure slash pull is mostly toward you into their body. Yes, Ross, I would say that
Yes.
is accurate.
My leg is here supporting. This is me pulling his tissue, his glute tissue.
You're hooking your
towards me.
calcaneus into that valley between the iliac crest and the greater trochanter, correct?
Correct.
And then you're dragging through.
Right.
Does that make
So
sense?
I do like this move because it's all hamstring pull right here. And I can get really low. Whereas if I want to get really low in our more traditional move we teach, right, which is standing at a diagonal, and your up foot works, I really have to lean out of my bars and push into that body to get above the trochanter and to start moving with my windshield wiper. Whereas the other way, I can just drag and then do my windshield wiper.
Mm-hmm.
Okay. Any other questions about hip 2? I think, the one thing that I've learned the most teaching for the last 10 years, or well, almost 10 years now, is how hard it is for everyone to start working on a rounded surface. Like the calves are rounded, the hamstrings are flat, and then we go to this rounded hip, right?
Yeah.
And so, look at how my arch contours the body. And when I wanted to contour the hip, either my up foot or my down foot, it contours it so perfectly. So try to let your whole foot be on the body. Try to work with what does it mean to plantar flex in the hamstrings so I can get my heel up onto the glutes so I can turn back around and go right back into that move. So those are, I think, the biggest takeaways that I want you guys to get comfortable with is that, our foot contours these rounded surfaces really, really well. We just got to start to play around with the angles. So, like when I'm here, the one thing that you're missing, let me see if I can move my camera without dropping my computer. So, you won't see the hip right now, but when I'm here, I'm at the ischial tuberosity. I lean forward a little bit so I can plantar flex, and then I get my heel up onto the glutes, and then I'm standing straight up, and then I'm turning back around to face my client's body. So I hope that was helpful. When we're here and our hands are on the bars, we're doing our alternate move that I just showed. We're just dragging right up. I really only need one hand on the bar. I'm windshield wipering. Do you see how in my windshield wiper, I'm not doing this? This is all muscle that you're using, and it's going to cause you hip and leg pain. But when you notice, for me, when I'm windshield wipering, here, this feels a lot more controlled to Brian. And I'm just moving my torso and my hips together. Everything's moving as one.
Stephanie
And
said thank you for showing hand positions.
yeah, and then we come down and I'm leaning forward again a little bit to get a little bit momentum, and then I'll come and face my client's body. And I'm just going to feather back. Just feather back. There's no need to add a bunch of like dragging. When people do this, they drag. This is all sartorius, gracilis, psoas. All of that's going to cause you hip pain in the long run. So using our gravity and using I'm really out of breath and using just the arch of our foot and allowing things to settle and to fall and flow is how it's going to work the best for you guys. So any questions? I'm going right back into hip 3, aren't I, Abby? Okay, I'll spotlight myself. We got 15 minutes, so whew. Okay, let me spotlight. Let me readjust Brian.
And then
How
don't
you
forget to
doing,
move
B?
your camera back down
Oh yeah, I will. Thank you.
because we're
I
just looking
already
at
forgot.
It's hard to work and talk at the same time.
It is. Okay. I'll do this here for right now. And I'm gonna just first make sure I have the right amount of lubrication on his side body. I just want you guys to know that this is ashi butter, and this is all I took to make sure that he has enough lubrication. Ever since Karen was like patting product on people, I started patting the ashi butter in, and that is so much better. But I do not need a lot of lotion. And I don't know if you can tell, but Brian does have quite a bit of leg hair.
Somebody, ABCD Boyle, is asking, can you show getting the leg into that position mid-flow?
Yes,
Do
I
you get
will
off
go
of the
back.
table to frog leg your client?
No.
Okay.
So after I would do I would do Venus flow in my normal sessions. I come in, I do hip two. So I do start with a more aggressive warm up. Do hip two. I step over to the side of the table to drag the tissue down off the back to do hip one. And then I would turn around 1 foot on each side of my client. Have you bend your knee? No, no, no. Thank you. Brian's
He's
too
trained.
trained. Yeah. And then I'm going to take your knee and bring it out to a figure four and come down. Okay. And then I adjust the draping. Does that help?
I think that looks pretty good.
Okay. So, how we teach this move to begin with is we're going to compress. This is
Page
where Abby
something.
likes to do her AMA rolls.
I'm in charge of the chat.
Everyone needs to be remembered that everything is elevated in the glutes now in this position. So it's going to be more sensitive. I'm going to come in with a tarsal twist for my warm up. I do not come past the piriformis, which is right here. Anything in this area typically does not feel good to my client and warrants concern that I'm going to slip and hit something I shouldn't hit. So I stay piriformis and above. When we are ready, we're going to take that tissue, we're going to drag it over the greater trochanter, and we are going to come down the lateral IT band. My heel is thinking about coming to the table. I had to pivot, even though I'm 5'8" and Brian is 6'2", to flow through the anterior shin. There's zero reason to feather back. I just pick my foot up and come right back into that move again. So I'll do this one more time. We're going to compress. You can do some AMA rolling. I like just to tarsal twist. I can definitely do some heel pressure and I'll just sit with it. I'm going to come over the greater trochanter when I'm ready. And I'm going to come down the IT band. And I'm really thinking about bringing my heel to the table. So my arch is doing all the work. And then I pivot to come down the anterior shin. So if we are here, this is all bone. This is all femur. And my heel is just scraping that bone and IT band, and it does not feel comfortable. And this is where a lot of our students like to start. I really want you guys to get comfortable with pulling the tissue over, leaning out of your bars a bit to get onto that femur and see how my foot is angled coming, reaching for that table. Then I rotate and pivot this non-working foot to face down my client and I'm pulling into the bars.
Lynn, Dolores had a general question. How can I learn draping so I can incorporate ashi tai while doing ashi? That draping into figure four was amazing. I just simply answered and said, great question, but that's a different topic. And we probably should have another Sole-ful Connection Hour about that. Oops, I spelled it wrong.
It's actually been discussed in 2 of my ashi tai
Yeah.
Sole-ful Connection hours.
Yes.
That if she's a graduate of, she can have access to.
Yeah,
So
Dolores,
email me.
you should have access to them if you are a graduate and a member.
Okay, so before Abby jumps back up, because I want to make sure she gets enough time to do her variations.
Carrie,
Uh,
real quick with that lean out, which bar were you holding on to? Was it the
the
closest?
one directly above my head.
Okay, so yes, it was the closest bar, Carrie.
So a lot of clients have problems coming into this position, right? And like maybe they like, if you get them into this position, they're like way up here. It's just like all this weird awkwardness going on with their hip. I like to come in with a bolster, and I'm going to put it underneath my sheet today. So I'm just going to have you lift up, Brian. And I am going to actually get this bolster all the way up next to his body. And then this feels really comfortable for people if they are having a really hard time bringing that leg out into that figure four. I'm going to come back here. Sorry. So this is what it looks like. This is the edge of my bolster. It's right up against Brian's body. And then the top part of his femur has a lot more support. If I still need to get this supported, I'm just going to do this. I'm going to angle it a little bit more. And now he's even more supported in this position. So if people need this bolstering, you could even get, a bigger bolster like this to come in, and I can show what that would look like.
Kimberly is
But what
saying sometimes my client's lower leg gets shifty. This does happen sometimes and tends to straighten. Will that bolstering help with that?
No, you need to tie their foot down with the
Yes.
sheet.
Yeah.
No,
So
I
if
would
their
suggest
foot,
I would suggest bringing the knee up higher. If the leg straightens or pops up, you just need to bring the knee up higher, closer to their body. That will create,
yes.
it just means they have a tight hip.
The
So
other
bring
thing
their
to
knee
do
up
is to
higher.
do this, is just to take the bottom sheet,
Oh, I'm sorry.
wrap it around their ankle, and use the other leg to hold it in place.
Mhm.
But you may need to get them further up, like Abby was saying, to here. And depending upon your table width, that may or may not be feasible. This is a 35-inch table, and Brian's knee comes off. So just so we know.
I think
Now,
if I have a client, Kimberly, who does that with their lower leg, I'll start them anterior because
mhm.
they'll generally need more hip loosening.
So now I'm going to work the hip and the glutes from this angle. If I want to work the IT band, I will still come back over here and I will still drag down the IT band this way. I will not go through the lower shin. I just don't have the room to really pivot very well with the bolstering in, but I still can feather down the IT band. I like to now turn back over and work this way with somebody, because what I'm really going to do is just sit with compression. And I might do some heel twisting in here for them. But if they're already struggling in this position, I really don't want to add a lot more for their service other than to bring them out here and to just compress. But if I come down the IT band this way, this is all femur right here. There's no muscle. So it still isn't as a good of a stroke at all coming that direction versus actually coming this direction and pulling the tissue over the greater trochanter and hitting that anterior quad and IT band. Okay. Any other questions so Abby can get going?
Nothing is coming through. That was very nice, Lynn.
All right,
Thanks.
great. Abby, you are up for your hip 3 modifications.
So we've just finished our hip 1 and 2. Our arm is still on the table. So I want to just gently move the arm off the table. I'll go back into the draping again. I like to cover up the glute. My outside hand reaches down for the heel. My inside hand grabs the inside of the sheet and takes the sheet with me as I bring the knee out. That way they're nice and tucked in already. I do like to do the armor roll at this point, and I like to do it over the sheet. So I'm going to just step back. You notice that was only a couple of steps on the table. We don't want to be walking around the table too much. So my heel of my working foot is going to find that nice little hip pocket right above the greater trochanter and below the iliac crest. So I'm going to work through the sheet, but hopefully you guys can see this. So my heel fits in really nicely, and we do the Anma roll. Okay, from there, I just undrape my client a little bit. Got to put a little cream on. And to find the place where I want to tarsal twist, I'm going to find the sacrum and the greater trochanter and tarsal twist. Now remember, checking in with your client is very important because even just a micro movement, being like a little more superior or inferior, lateral, medial, it makes a really big difference when you're working on the hip. So being in the right place for your client is very important. So my recommendations is just to ask my client, does this feel like a productive area? Eileen, is this all productive? She's saying yes. Would you like more or less pressure?
That's good. Yeah, that's good.
Okay. And she's good with my pressure. When I come down, I'm going to lean back. This is one I used to windsurf, so I like to tell my students, pretend like you're windsurfing. Just a little, so we straighten the knee so that our heel drops down and goes down that IT band. Nice and smooth. When we come down, we're just going to shift a little bit. And personally, I like to go all the way off the foot. Go down that side foot. And I do like the drag back. The drag back to me feels really like just comforting and complete. And if I need to, I'll turn towards the head of the table to aim more at glute medius. It's where does my client need this work? My palpation skills, my listening skills. I'm asking myself while I'm working, am I in a productive spot also? And then we can also then go into, let me move my foot this way. We can also get that TFL, glute minimus, in this position as well. So any questions on that?
Kimberly likes, she said, ooh, I like the heel and looks great.
Yeah, so we can be here where we're facing towards more at an angle.
TFL. Oh, yes, Kimberly. I was wondering what that was. Looks great.
Now, sometimes when we go off the foot like this, it will be a little tender for some people's feet the first time. So doing this a second time is often very helpful. I think that that really just connects the body as well. And then to go into glute medius, we just continue on this way. And then
Abby, when you're dragging back, is it a feather drag or like a venous flow? What's the pressure of the drag back?
honestly, I feel like it depends on my client. So I do have some clients where I don't apply very much pressure. I wouldn't call it a feather stroke though.
Mhm.
And there are some clients where I feel like, especially if they're lower leg, this is an example. I come down, I'm going to really apply pressure. Can you see that I'm really applying my pressure there?
Yeah.
Yeah, if my client really needs the leg work, I would apply pressure because it feels very productive. And if they needed more in that leg area or even that hip flexor, I can also just spend a little extra time here.
Thank you.
Do you do this with the arm up, Abby, too, or no?
I don't. This one is the
Okay,
off because we do need that standing area. Yeah.
cool.
Okay. So that's what I wanted to show today. I hope everyone's enjoyed and just keep practicing your hips. You'll get confidence with practice.
Real quick, Dolores is asking, should all dragging be feather? Because then we're not using our body weight. Is that correct? I would disagree, Dolores. Sometimes I drag back with a little bit of pressure.
Yeah. I'm
Lynn,
going to say
say?
And
all
I would say every time you drag back, you're going to be muscling it. So you have to be mindful of how you're dragging back. And is it appropriate to use your muscles? And are you creating knee or hip pain for yourself with that drag back? So there's definitely some times where people are dragging back with pressure. However, the flow and how
Forceful
we get
pressure.
and how we get our pressure is to step using gravity and then using that flow going down the body. Whenever you drag back, you will be engaging your own muscle groups to do that, which is why I encourage people to not do that.
Yeah, and I'm going to say that you definitely have to work with your comfort in your body, right? So what works for you, every class we often have to have modifications for, people where they are at the time. What is, your abilities? The dragging back is not like as therapeutic of a stroke. It's not as an important stroke as the ones that we're implementing and going down the body. Absolutely, those are the most important. The drag back is really just an additional, it's just like working with your hands, I guess,
Right.
Yeah, so it's your personal style. I mean, practice it. If you like it and works for your body, I would say, check it out.
Charlotte says my adductors are super tight since starting Ashi. So I would think, Charlotte, you might be working too hard, girl.
I say it's like a Pilates class, taking an Ashiatsu class.
Charlotte, there's a bunch of YouTube videos on my YouTube channel, which is Rooted Wellness and Spa. You can check out workout videos there. Brian is schooling me on how to work out. And because he is a body in my classroom all the time and gets massages from me all the time, he knows exactly what I need to strengthen and how to strengthen. So it's super fun to find a personal trainer that you can trade with. Brian asks me all the time, like, how are your hands placed on the bars? What are you doing here? And we do pull-ups and chin-ups where and how I'm going to be using my hands on the bars, which is super helpful and fun. So finding a personal trainer to help you with that is great, but watch our YouTube videos. We have 2 of them out on how to, build some strength up for those legs and hip flexors and abductors.
Is anyone near Nevada City, California? Bonnie would like to trade or practice. Ann or Annie would like to know, what's your site again? Oops, I lost it.
It's Rooted
Kimberly
Wellness
Rockland.
and Spa.
Rooted.
I can put it in the chat or
Okay.
on the follow-up email too, but you can go to Cali DeepFeet or Rooted Wellness and Spa.
Is
Rooted
your
Wellness and Spa is the YouTube channel.
rooted? Okay, that's what they're. Is your YouTube linked on Cali DeepFeet?
It could be. It should be. It should be because that's where
Okay.
these videos should reside. Any other questions, you guys? I want to be, respectful of everyone's time. We're 5 minutes over. I do want to thank you all for being here. And Abby, So you guys may not know, but Oahu has had a ton of storms. Abby had an entire rock slide happen. Her property flooded.
My
She
car
lost her
flooded.
car.
Oh
She
my
got a
goodness.
new car, but she made it today. I just want you guys to know that she made it for everyone today. And we really appreciate you, Abby, putting forth
Yeah,
that
thank you,
extra
Abby.
work and
And you too,
coming
Lynn, and China.
out and hanging out with us. I know that you've been going through a lot, so I want to, just put that out there for everyone and let you know that we love you. And we've been sending lots of good vibes for the Hawaii crew out there because you guys have been getting hit with back-to-back storms.
Crazy.
Next month, China and I are going to talk about event setup, mainly China, because that girl, if you don't follow her on Instagram, you will not know that she seems to be doing an event like every other day.
Yeah. Yeah.
Yeah.
So I got it. I could have set up a booth in my sleep.
Yeah, she has got it to going on and has got it together. So if you want to set up a booth this year or you have been thinking about it, tuning in next month will be a lot of fun to figure out how to set up a booth, how to make it fun for people, interactive, and all that good stuff. And then the next month, we will be talking about arterial disease with my husband and I. And then the rest of the year I have coming out, and I will get that posted up as soon as possible. But we will see you guys next month, and we hope you guys had a great week. And thanks for joining us.
Thank you, everyone.
Thank you, everyone.
Bye.
Aloha.